Hello everyone, good to see you. This is the respiratory guy. Hope everyone is doing well. Today I'd like to take just a brief moment to discuss some technology that we routinely use in healthcare today and many times we take for granted, and maybe provide some tips and tricks that might help you as a respiratory student, nursing student, or even a patient that's using one of these devices to ensure that you're getting a good, accurate result from that technology. And that technology is the Pulse Oximeter, everybody. Yes, the Pulse Ox. What a great little advancement in technology. These arrived on the scene sometime in the early 90s. These devices were very large, took a lot of computer power at the time, and were very crude and rude, but they did really give us a glimpse of how easy it could be to measure oxygen saturation in the blood of a patient. So through the years, they've become more compact, less expensive, pretty overall accurate as we've been going through the progress or progression of this technology. So these devices, the oximeter they use a small processor, a pair of small light emitting diodes. And these LEDs are facing a photodiode through a part of your body, usually your finger or your earlobe. So they kind of oppose each other. One LED is red, and that wavelength of light is about 660 nanometers. And the other infrared light is at a wavelength of approximately 940 nanometers. The absorption of light through these wavelengths differ significantly depending on the blood that's involved, right? Blood loaded with oxygen or arterial blood, or blood lacking oxygen or venous blood. So oxygenated hemoglobin absorbs more of that light and allows more red light to pass through the finger. And deoxygenated hemoglobin allows more infrared light to pass through and absorbs more of that red light. So that's generally how these devices function. One of the generally provided tracings that the monitor will display is what we call a plethysmography, or a pleth. And basically the pleth measures the volumetric changes associated with a pulse, or the pulsatile pulse for the arterial blood flow. So when you feel your pulse to get your cardiac rate, you can correlate that display on the monitor, that pleth, with what you're feeling in the pulse. Those two numbers should match within a couple of beats per minute. If they are, then you can rest assured that your pulse ox number is reading accurately. If they are not, it could be movement or some other artifact that's making it difficult for the pulse ox to read accurately. So if your pleth is showing a very fast beat per minute and your pulse rate is maybe normal at 70, you probably have movement or some interfering issue that's causing the pulse ox to read inaccurately. So although this equipment is outstanding, easy to use, there can be issues, and we always suggest that clinicians use their experience, their eyes, and their assessment skills to make sure whatever technology that we're employing, that we're ensuring that we're using it correctly and we're getting good results. Okay, so use the pleth as a guide to ensuring that your pulse ox is functioning. Just don't take that number for granted and write it down that that's exactly what's happening. In most situations it is, but there can be situations where the pulse ox is not reading accurately. Movement being one of the biggest issues really when it comes to pulse oximetry measurement. If a patient's moving their hands, their fingers, in the case of a neonate where you might have it on the toe, then that movement can cause interference, and the pulse ox just has a difficult time reading that number. So let's talk about some just real practical things that we can do out there to ensure that we're getting a good pulse ox reading. Again, double check your pulse, review the pleth if there is a pleth displayed on the monitor, and ensure that they match. Number two is always follow the manufacturer's recommendations. So in the case of a hospital pulse oximeter, they might come with different type of sensors for different populations of patients that we treat. Always use the appropriate sensor for that population. You do not want to use a pediatric pulse oximeter sensor on an adult. You certainly wouldn't want to use a neonate sensor on adult, and vice versa. You always want to use the appropriate sensor. Even with one of these, you suggest that you get the pediatric version because the opening for the finger is so large. For a peds patient, there could be some refracted light that can get in through the sides and make your number inaccurate. So always follow manufacturer's guidelines and use the proper sensors for the particular patient that you're using the pulse ox on. The other thing is sometimes our nail polish can cause problems. Anyone wearing nail polish and you're putting on a sensor or a pulse ox, there could be some issues shining the light through the finger and getting those readings. So one might consider getting some adhesive remover and taking the polish off the finger, or possibly using another site like the earlobe site, or some systems even have a forehead sensor that can be quite effective. Now, patients also can shunt blood. So when patients have situations with blood pressure, or possibly even when they're cold, they might shunt blood away from the extremities to protect, obviously, the core organs. And there have been situations where people become pretty cold and their fingers may be shunting a little bit, and this might have a little harder time picking up that pulse. So keep that in mind when you're using a pulse oximeter. These are simple things that we can do to ensure that we're getting accurate results for our patients, and never taking these things for granted. All technology out there can malfunction, can be used inappropriately, and provide false information that at the end of the day doesn't really improve the care we're providing to our patients. So just a couple tips and tricks on pulse oximeters. Again, they've really changed the world. We even have them in watches now. People can take pulse ox measurements when they sleep, and I think there's a whole new future of wearable devices that I think we're going to leverage in the future. Watches and technology that can read data when we sleep or when we're at home, and we can provide that data to our physicians to help better manage our treatment. So I think there's a whole new world that's going to open us up to us with these wearable type technologies, as well as using telemedicine and video conferencing to interact with our providers more real time, so we can get better care moment to moment. And I think all of these are very exciting things, just like the pulse ox was when it came out in the early 90s and continues to be utilized quite frequently today. So please drop any comments or questions, concerns you have in the comment section. Love to hear from you all. And until next time, be well.